as someone who's world renowned in FPEF, and you had such an illustrious career in research and academics, what advice would you have for early trainees like myself to who want to pursue this career in academics and research?
Well, I think it really starts with having a passion for the research, with getting hooked on the research question. And that can start early on. It can develop a little bit later in your career. But a lot of these key observations really start at the bedside or in the clinics when you're seeing patients. There are questions that come up every day in clinic or in practice in the hospital that don't really have a good answer from the evidence from trials, and thinking about those is really where the best science, clinical science, comes from. So keeping an open mind and staying inquisitive about those things. And then, the other key aspect is when you find something that you're interested in, an area, whether it's heart failure or electrophysiology or atrial fibrillation or whatever, really get to know that literature thoroughly. Because if you read everybody else's papers, you're going to understand the lay of the land, and you're going to know right where the edge of understanding is, and then you can push that boundary a little bit farther and ask the right questions. And then I think it's also really important to hook up with a good mentor, because none of us can do this on our own. We need to learn from others. So that's the other key component to keep in mind.
Perfect. Thank you. Thank you so much, Dr. Borlaug, for being with us today. For more videos like this, follow us on Twitter at FitsOnTheGo. And to watch the full video, go to youtube.com/FitsOnTheGo.